This video lesson will focus on cardiovascular disease, the most prevalent lifestyle disease in the Australian community. So what is cardiovascular disease? Cardiovascular disease is any disease of the heart or blood vessels. Unfortunately, cardiovascular disease, or CVD as it is often known, kills one Australian every 12 minutes and accounts for 30% of all deaths in Australia. Of those Australians still alive, it infects 1 in 5 of us. In particular, low socioeconomic groups, those of Aboriginal or Torres Strait Islander background, and people living in remote communities have the highest rates of cardiovascular disease in Australia. The majority of cardiovascular disease is caused by risk factors that we can actually control or modify by some kind of medical or lifestyle intervention, such as high blood pressure, cholesterol, overweight or obesity, tobacco use, lack of physical activity, and diabetes. Of these 6 main risk factors, we're going to take a closer look at cholesterol now. So what is cholesterol? Cholesterol is a fatty, wax-like substance that forms part of the structure of cell membranes in the body. Cholesterol is also important for the synthesis of hormones such as estrogen, testosterone, and the adrenal hormones, as well as vitamin D production and the production of bile acids used in digestion. The structure of cholesterol can be seen at right. Blood cholesterol levels are affected by cholesterol absorbed from foods in the diet, as well as cholesterol synthesized in the liver. The amount of cholesterol in the blood is linked to the total amount of saturated fat consumed in the diet. The Australian Heart Foundation recommends that adults keep their cholesterol levels below 5.5 millimoles per litre and children keep theirs below 4.5 millimoles per litre. The reason for limiting blood cholesterol levels is that reducing blood cholesterol can reduce fatty deposits in arteries. One way to do that is to swap polyunsaturated fat for saturated fats in the diet. There are 2 main types of blood cholesterol. One's good and one's bad, as shown by the cartoon at right showing the angel and the devil. High-density lipoproteins are known as good cholesterol. The reason for this is that they carry cholesterol away from the arteries for disposal. This can be seen in the diagram at the bottom right, with good cholesterol or high-density lipoprotein shown in green, which is passing through the arteries, whereas the low-density lipoproteins shown in yellow are considered to be bad because they can build up in artery walls and cause blockages. Atherosclerosis is the process whereby arteries are hardened by lipid deposits. Lipids and cholesterol, as mentioned, can deposit in artery walls, eventually leading to narrowing of the arteries and complete blockages. Typically, atherosclerosis affects large and medium arteries and occurs where arteries branch or at other points of stress in the arteries. Often the aorta, the main artery from the heart, is affected, but it's also common for arteries supplying the heart, the head or brain and neck, the kidneys and lower limbs to be affected. This can have devastating consequences. Atherosclerosis is a main component of cardiovascular disease, which can lead on to heart attack if the arteries supplying the heart are blocked, stroke if the arteries supplying the brain are blocked, gangrene if the arteries supplying the lower limbs are blocked. Additionally, any tissue supplied by a blocked artery will eventually die due to lack of oxygen and vital nutrients. So how can we go about preventing atherosclerosis? This slide shows a range of risk factors for atherosclerosis and cardiovascular disease, some fixed, some positive, and some negative. The fixed risk factors include aging, genetics and heredity, gender and ethnicity. These are risk factors that we can't do very much about, but we need to be aware if our particular age, genetics, gender, or ethnicity do put us at a greater risk of cardiovascular disease in order to monitor the disease. The negative risk factors, excessive alcohol consumption, cigarette smoking, diet and obesity, all increase our risk of developing cardiovascular disease, whereas the positive risk mentioned here, a healthy diet, physical activity, vitamins and antioxidants, and even a small amount of red wine can actually decrease our likelihood of developing the disease. Let's go into these in more detail. Dietary risk factors are anything related to the foods that we consume that increase our likelihood of developing a disease. For cardiovascular disease, an increase in low-density lipoprotein levels will lead to an increased likelihood of atherosclerosis and subsequent heart and blood vessel disease. Increased LDL levels are linked to high intake of saturated, hydrogenated, and trans fatty acids. On the other hand, decreased HDL levels, or high-density lipoproteins, the good cholesterol, is linked to an inadequate dietary intake of omega-3 essential fatty acids, which we get from our unsaturated fats. Another dietary risk factor is overweight and obesity, which puts extra pressure on the heart due to increased blood volume. And finally, excessive alcohol consumption also increases the risk of developing cardiovascular disease. Next, we have the lifestyle risk factors. Physical inactivity can lead to weight gain as well as a weakened heart, and therefore it makes us more prone to cardiovascular disease. Stress increases blood pressure, which is also known as hypertension, a condition where arteries gradually become less elastic as the heart has to pump against an increased pressure. Cigarette smoking also hardens and inflames arteries, making it more likely for disease to occur. These risk factors are considered controllable risk factors because we can make lifestyle choices which minimize the risk. Finally, there are other risk factors which are considered uncontrollable, things like genetics. We may be born with a predisposition to overproduce cholesterol, and heart disease can run in families. Unfortunately, the risk of cardiovascular disease increases with age, as shown in the graph at the bottom right of the screen. You can see an almost linear trend from the age group of 18 to 44, where there is a very low risk of cardiovascular disease, up until the age group of 75 plus, where the risk for both males and females is well above 60%. The final risk factor is gender, where males are at a higher risk due to the tendency to deposit fat around their abdomen or heart region. So with these risk factors in mind, it's important to think about modifications that can be made to diet and lifestyle in order to reduce the overall chances of developing disease. Some diet modifications include choosing low-fat foods like vegetables, fruits, grains and cereals, cutting back on foods high in saturated fat such as butter, margarine and chocolate, choosing lean cuts of meat with the fat removed and fish, avoiding fatty and deep-fried foods, and opting for low-fat dairy products. Additionally, some changes can be made to the way that we prepare and cook food in order to minimize our dietary risk. For example, cooking without adding extra fat means choosing methods such as grilling and steaming. You can use low or no fat salad dressings and certainly make sure you're choosing oils and fats that are unsaturated rather than saturated. Snacking on low fat snack foods, reducing alcohol intake, sugar intake, and avoiding salty foods to keep the risk of hypertension down. Finally, increasing soluble fibre in the diet by including foods such as oats, barley, legumes and chia seeds can actually help to remove harmful LDL cholesterol from the body.